Hello, thanks for joining us this afternoon. During today's webinar, we're going to be giving you the knowledge and tools you need to answer the question, is your long-term care home ready to build a living classroom? Scott Mitchell from the Schlegel-UW Research Institute for Aging will be leading us through this webinar. There's a PDF file of the handout for this webinar, which has the slides on it, two per page, where you can write notes on it if you like. It's in the handouts box on the right-hand side of your screen. You might have to click on the arrow beside where it says handouts to get the box to expand so you can see the PDF file. Also, just to let you know, we will be sharing the webinar recording and the PDF file of the slides with all of you who signed up for this webinar. And also be sure to stay tuned until the very end, as that's when the evaluation survey will pop up on your screen. And those of you from Ontario long-term care homes will be able to receive a free copy of the Living Classroom Guide by completing that survey. And in case you're wondering whose voice this is, I am Kate Duchek, a project officer with the RAA in Waterloo, Ontario, and I'm going to be your moderator for this webinar. This webinar is brought to you through the Centre for Learning, Research and Innovation in Long-Term Care program at the RAA. The RAA is a charitable nonprofit foundation that links research, training, and practice to enhance care and quality of life for older adults. The RAA supports practice-relevant research and mobilizes evidence so it can inform programs, be integrated into various forms of training, and as well to make positive changes to practice and policy. So the Ontario CLRI, it strengthens the quality of care and living for people living in long-term care here in our province through training and through knowledge mobilization. The Ontario CLRI is hosted at 3 centres, which in addition to the RAA are Baycrest and Briere. And we're able to do this thanks to funding from the Government of Ontario. I would like to also take this opportunity to acknowledge the traditional territories of the Indigenous people whose land we are all very thankful to be on. And I'm very happy to be part of the RAA and CLRI teams and have the chance to be in touch with you all today during this webinar. And we're really excited to have Scott leading it, and I'll turn it over to him now.
Great, thank you, Kate. And thank you to all of you for joining up and joining the session today. So I am a knowledge broker based at the Ontario Centre for Learning and Research and Innovation at the Schlegel-UW Research Institute in Waterloo. And our agenda for today, in the next 30 to 45 minutes, I will first of all touch on a few challenges facing the long-term care sector, particularly those related to education and workforce recruitment. I'll introduce the Living Classroom model, which is designed to help address those challenges. Then I'll describe the resources that we have available to support long-term care homes to build their own living classroom. Our most recent resource is a readiness assessment tool, which I'll introduce at the end. And then hopefully we'll have plenty of time for questions. And I'm going to thank Kate in advance. She's going to jump in every once in a while and ask you some questions. So looking forward to your feedback. By the end of today's webinar, I hope you will have a clear idea of what the living classroom is and the potential benefits. You will know the 10 essential building blocks of a successful implementation process and understand why and how to use the readiness assessment tool. If you work in Ontario's long-term care sector, you already know that the population in long-term care homes has undergone significant change in recent years. Residents are entering long-term care more frail and in need of more medical and personal care than ever before. So 2/3 of our residents have been diagnosed with Alzheimer's or another form of dementia. 90% have some form of cognitive impairment, not solely from dementia, but also from other causes such as stroke. Over 90% have 2 or more chronic conditions, such as diabetes, heart disease, or depression, and 1 in 3 are highly or completely dependent on staff for support with daily activities, such as getting dressed or feeding themselves. So naturally, as these care needs increase, so do the workloads of long-term care teams, especially personal support workers. Many homes are struggling to recruit and retain confident and competent PSWs who can meet the complex needs of residents. A number of factors contribute to this workforce challenge. First, when we look at the size of the entire workforce, the ratio of working age adults to seniors is shrinking. There just aren't as many people available to support our aging population. Figures from StatsCan show that in 1971, there were 6.6 working age adults per senior. In 2012, that number dropped to 4.2. And by 2036, it will drop even further to 2.2 working age adults per senior. So as a result of this overall workforce shortage, long-term care homes will increasingly compete to be seen as an employer of choice within the healthcare sector. Career appeal remains a challenging issue. Long-term care is not always perceived as an attractive work setting, nor as a preferred career path for graduates in healthcare. I think there are several reasons for this negative perception. They include ageism, stereotyping of long-term care homes, low compensation as compared to other care settings, and limited understanding and exposure to long-term care homes. I think it's important to have new graduates from PSW programs who fully understand the long-term care environment. That can greatly improve the chances that they will choose long-term care as a career path. We also know that recent increases in government funding for community care, new hiring practices of PSWs in acute care settings, such as hospitals, mean increased competition and a shrinking pool of PSWs who can work in long-term care. And there are challenges in how we educate PSWs and other healthcare workers. Our college and university programs don't always prepare students to care for seniors. Working as a healthcare provider in long-term care is perceived as non-complex and perhaps less interesting as a career path. Education is often medically focused, while the social aspects of care are often ignored. And at the same time, long-term care homes are not always prepared to act as learning environments for students.
All right, and that brings us to our first poll question for you all. So we want to know which action should be the top priority to address the PSW recruitment challenge. So do you think it should be to end the stigma surrounding aging, to enhance the career appeal of PSW's role, to improve the quality of PSW training, to address competition for PSWs from other healthcare sectors, or to improve perceptions of long-term care as a work environment? And if you think there's a better fit for your answer, any other than of the ones listed for this poll question, just please enter your responses in the questions box on the right-hand side of your screen. And friendly reminder that you might have to click on the arrow beside where it says questions to get that box to expand so you can type in your answer. Yep, looks like the poll is just about done there. Give it another second for people to pick their responses. All right, and then so what it's looking like for what you all had to say for this question is that, that it seems like most of you are saying that it is important to enhance the career appeal of the PSW role, to improve perceptions of long-term care as a workplace, and to improve the quality of PSW training. Thanks very much for sharing your feedback about that. and we'll see if there was some other people who had a other response. And somebody was saying, you know, just funding for long-term care homes, that having better pay would help be able to better address the needs of workers there. Yep, so that seemed to be a common response. So thanks very much for sharing that, everyone. And I'll turn it back over to Scott here.
Great, thanks, Kate. So education, career appeal, improving perceptions. So many of the programs, many of the programs and resources offered by the Ontario CRI, such as Excellence in Resident-Centered Care, are designed to train the current workforce in long-term care. The living classroom that we're talking about today focuses on educating the future workforce. And it offers, I think, one significant way to respond to the challenges, not only of educating PSWs, but to recruiting them. So I'll get to that in a minute. So what is the living classroom? Living classroom is a full-length post-secondary education program delivered on-site in a long-term care home. So this is the formal definition of the living classroom that our partners, Conestoga College and Schlegel-UW, developed. So the living classroom is an interprofessional education program delivered in a long-term care home where faculty, students, and those living and working in the long-term care home engage in a culture of interactive learning. So the key elements to note are who's involved, where the program takes place, and the culture of learning within long-term care that both supports and is supported by the living classroom. Many of you may already host PSW students or nursing students for placements in your long-term care home. So one way to think of the living classroom is as a placement on steroids. So living classroom students do the regular PSW program. They also do placements as other students do. But unlike regular college programs, living classroom students, for the full duration of their program, are embedded within the long-term care environment. So there, they can observe and experience team dynamics, interprofessional practice, and build relationships with residents and family members. So the living classroom as a concept really has its roots in the teaching nursing home model that was first developed in the United States in the 1980s. Teaching nursing homes were created originally to accelerate research related to older adults, to enhance the quality of care, and to improve education for students. The model, teaching nursing home model, has been defined as linking and creating synergy between three traditionally separate spheres. Variations on the teaching nursing home model have appeared elsewhere in Australia, Taiwan, the Netherlands, Norway, as well as here in Ontario. The partnership between the Research Institute for Aging, Conestoga College, and Schlegel-UW embodies this concept of overlapping spheres, and the living classroom is one of the innovations to emerge from this integrated approach. In 2009, the Senate Special Committee on Aging had this to say: changing the way we educate healthcare providers is key to achieving system change and to ensuring that healthcare providers have the necessary knowledge and skills to work effectively in interprofessional teams within the evolving healthcare system. So, how does the living classroom improve education and workforce capacity? First, access to education is improved by locating the living classroom within communities that may not have an existing college program. This can increase enrollment in PSW programs by bringing education closer to where prospective students live. The living classroom has benefits for long-term care teams and post-secondary faculty too. The program promotes continuous learning and sharing of best practices between educators and frontline staff. This two-way exchange can improve care in the home and improve the quality of PSW programs as frontline experience and knowledge are shared back to the college. Long-term care staff gain opportunities for personal growth and development by mentoring the next generation of PSW students. And by working alongside faculty and teams in the home, students get exposure to a wider variety of role models than they would in a college setting alone. A key benefit of the living classroom is that it creates an ongoing opportunity for engagement and interaction with residents and family members. This creates a meaningful role for residents who can share their wisdom and their stories with students, and both parties benefit from the personal relationships that develop. We've seen, for example, that many students choose to volunteer in the home outside of class, and many of the friendships with residents continue long after the program ends. Because the concepts the students are taught in the classroom are immediately translated into practical experience in the home, students graduate from the living classroom with greater confidence and stronger skills that prepare them for careers working with older adults. Many PSW students enter college programs really without a fixed idea of where they want to work when they graduate. Through greater exposure to the long-term care environment, living classroom students are more likely to graduate with stronger intentions to choose a career in long-term care. At the same time, long-term care homes that host a living classroom are well positioned to recruit students straight out of the program. And those students already have an established relationship with residents and team members, so they can hit the ground running. Finally, the living classroom contributes to the growth of long-term care homes as learning environments, not just for students, but for all involved. The bottom line is that PSWs who graduate from the living classroom are workforce ready for long-term care. They have the skills and the motivation to provide quality care for seniors. These testimonials speak to the value of the living classroom from the perspective of both residents and team members within the long-term care home. And these were collected during an initial evaluation at the village of Riverside Glen. So a team member from the village reported that students we have hired from the living classroom have been phenomenal. They understand resident-centered care, and they understand interprofessional collaboration. And a resident observed that the students seem more motivated and more dedicated to their work when helping us. These outcomes can be traced back to the experiential learning method that immerses the students within a collaborative teaching environment. So first, a little history. In 2009, the first living classroom was launched at the Schlegel village of Riverside Glen in Guelph with a class of 30 PSW students. So at that time, in 2009, additional long-term care beds were being added in Guelph, and all providers in the area had workforce shortages. There wasn't a local college program for PSWs, so Schlegel villages partnered with Conestoga College to improve access by bringing the PSW program into the village. They felt that this would not only attract students who lived in the Guelph area, but also increase the likelihood that graduates would stay in the community and serve local needs. And based on the success of that first collaboration, Conestoga and Schlegel villages created a second living classroom at the village of University Gates in Waterloo in 2015, this time working in partnership with the Research Institute for Aging. So whereas in Guelph, the living classroom was introduced into a pre-existing home, the living classroom at University Gates was purpose-built. This allowed us more flexibility to plan and build an ideal space, including classrooms, a clinical skills lab, high-tech simulation labs, practice apartments, office space for faculty, and a lounge area for students. So the college has full-time use of roughly 8,000 square feet of space with additional part-time access to lecture halls and meeting space shared with the Research Institute. The computer system is connected directly to the main campus, and Conestoga Student Services visit University Gates regularly so that students have full access to college resources. In addition to the PSW program, University Gates also offers a practical nursing program. So the nursing program actually started at Riverside Glen, but moved to University Gates when it opened in 2015 with additional facilities that were required for that program. And in January of this year, Schlegel Villages opened its third living classroom at the village of Wentworth Heights in Hamilton in partnership with Mohawk College. So the living classroom model, I'm happy to say, it's been spreading to other long-term care homes and colleges across Ontario. In the past few years, a total of 10 living classrooms that we're aware of have been opened. In addition to the 3 Schlegel Village classrooms, the Pearlie and Rideau Veterans Health Centre in Ottawa opened a classroom with Algonquin College in 2017. And in January of this year, Algonquin opened another classroom an hour away at Bonachère Manor in Renfrew. Niagara College has opened a classroom at Grandview Lodge in Dunnville in the same year, 2017. Sault College has a living classroom in the small community of Fessalon, about an hour southeast of Sault Ste. Marie. And there are 3 living classrooms in northwestern Ontario delivered by Confederation College in Kenora, Dryden, and Fort Frances. So the partnerships, the various partnerships, the class sizes, and the use of physical space looks different in each location. So rather than a one-size-fits-all model, the living classroom can and should be adapted to local needs and resources.
Okay, thanks, Scott. And that brings us to our next poll question. And so this is one where you basically fill in the blank from the options. So our long-term care home would like to build a living classroom within the next 1 to 2 years, the next 3 to 5 years, sometime in the future, undecided, or not interested. So I'll give you another minute just to make your options there for this poll, which one you think is the best response for your needs at this point in time. And it looks like the poll results are pretty much settled from this one, so I'll just flip it over and share it with you all. And so as you're able to see here, most people who are joining us today plan to build a living classroom within the next 1 to 2 years, followed by at some point in the future, and then a tie between within the next 3 to 5 years, you'd like to build a living classroom, with some people being undecided.
Well, I'm glad everyone's interested, and I guess that's why you're here today, so good news. Okay, so if you are ready to build a living classroom, the Research Institute for Aging offers a number of resources through the CLRI. So a good place to start is to see the living classroom in action. We offer tours of the living classroom here at the Village at University Gates in Waterloo. I've shown you a few pictures in the presentation, but I think visiting in person is a much better way to understand what's required within the physical environment, and really to start visualizing how the living classroom might manifest within your long-term care home. So please feel free to get in touch, and we'd be happy to arrange a tour. If you want to read more about the living classroom or dive into the research literature that supports the model, I invite you to visit the Living Classroom website at livingclassroom.ca. So the Research Institute for Aging has created a Living Classroom implementation guide. This resource is based on the experiences of Schlegel Villages and Conestoga College in launching and evaluating the first 2 living classrooms in Guelph and Waterloo. So this is a step-by-step manual, and it's available to download free of charge from the Living Classroom website. We also have hard copies printed, and as Kate mentioned at the beginning, you can request a free copy, which we'll mail to you when you fill out the feedback survey at the end of the session. So the guide is currently available in English only, but the French translation will be ready later this spring. So that will be available on request as well. So the implementation guide introduces 10 building blocks for a successful living classroom. And the building blocks are presented sequentially in 4 stages. So this really walks you through the process, starting with exploring the potential, developing the foundations, doing the actual implementation, and then promoting and sustaining the living classroom once it's established. Stage 1, exploring the potential, includes 3 building blocks: agreeing on a shared definition, determining whether a new living classroom is in fact operationally viable, and identifying win-win opportunities. So operational viability is dependent on many things, including the legal environment, market considerations, including enrollment capacity in your community, potential operational barriers, and startup costs. The legal environment would include, for example, regulations, program standards, accessibility legislation, thinking about public health and occupational safety concerns, and importantly, municipal zoning bylaws in your area. Win-win opportunities are really the shared objectives and benefits that can be gained from a living classroom collaboration between the college and the long-term care home. And it's important to spend time upfront thinking through those and coming to a common vision. So this is where the 2 organizations really have a shared vision of the potential. Stage 2, developing the foundations, includes formalizing the collaboration between the 2 organizations, committing to the physical space requirements, and creating formal agreements and standard operating protocols. The implementation guide includes detailed notes about protocols, for example, around safety, around communications and signage, building operations, the support services that are required, and team member engagement. The 2 formal agreements that are discussed include a use of space agreement and clinical affiliation agreements between the college and the home. Stage 3 is about implementation. So building block 7 focuses on creating a successful team, including college faculty and long-term care staff who will deliver the program. So having the right people in place is really your greatest asset. This section of the guide will help you define appropriate roles and responsibilities. Implementation also includes adapting and integrating the standard PSW curriculum to take full advantage of the experiential learning environment that a long-term care home presents. And the critical step is defining your communication and coordination mechanisms. These really are essential for a well-functioning partnership. So these mechanisms might include program handbooks, orientation sessions for both students and staff, newsletters, regular meetings, keeping residents and family members informed, and so on. The final building block is about promoting and sustaining the living classroom. This includes monitoring success through evaluations and examining the potential to grow the program. So there is a section in the guide that walks through some options for evaluating the program. But the PSW program that we're seeing in most living classrooms is really only one of many teaching opportunities within the long-term care home. So the diagram to the right suggests really the unlimited potential to expand the living classroom concept to include other professions such as recreation therapists, pharmacists, physiotherapists, could include management and administrative services, non-medical professions such as food services, even community health services like paramedic training, and engineering and design. When you think about the full complement of of professions that are involved in running a long-term care home. Once you've created that learning environment, there is opportunity to think about using it to good effect. So at the Research Institute, we're continuing to explore new ways to expand the use of our facilities. In November, we hosted an education day that focused on the importance of nutrition and improving the mealtime experience for residents. We brought 15 students from Conestoga College's Food Service Worker Program to hear from registered dietitians, from leading researchers in nutrition and aging, from food suppliers, and from long-term care residents themselves. The day was intended to give students a glimpse of a possible career path in long-term care. Of course, not every long-term care home is necessarily ready to adopt the living classroom model for a variety of reasons. So to help answer the question, are you ready? We've developed a checklist to help long-term care homes do a preliminary self-assessment. So what do we mean by readiness? So this is one definition. Readiness is the extent to which organizational members are both psychologically and behaviorally prepared to implement change. The idea of readiness includes several components: organizational culture, organizational climate, and implementation climate. Organizational culture refers to the behavioral norms and expectations within the workplace. Organizational climate is defined as the shared perception of how the work environment has an impact on personal well-being. And implementation climate refers to employees' shared beliefs about whether an innovation will be supported and successfully implemented within the organization. The readiness includes both general and innovation-specific factors. So general factors are those that are likely to affect the organization's readiness for any innovation. And there are tools available that are focused on that level of general readiness. Innovation-specific factors are elements that are unique to the particular innovation you're planning to introduce into the home. So why should long-term care homes do a readiness assessment? So research suggests, not surprisingly, that your level of readiness is related to the likelihood of success when changing practice or implementing a new program. A readiness assessment helps you to reflect on potential barriers as well as facilitators of success. The readiness assessment tool that we've created for the living classroom includes some general readiness questions, but the emphasis is primarily on innovation-specific readiness. To develop our tool, we looked at some existing best practices in readiness assessment, and there's been a fair amount of research in the implementation science. We drew on our own experiences of developing a living classroom, understanding what that process looks like and where the roadblocks might be. And we also reviewed research that was done on teaching nursing homes in the US. And there were a couple of quite large studies to identify really the significant success factors or prerequisites for a living classroom, as observed in the homes there. So our readiness checklist currently includes 19 questions, so it's not particularly onerous to complete. And those questions are grouped under the 7 categories listed here. So I'll just explain these briefly. So for any new program or organizational change to succeed, senior leadership need to believe in the value of the innovation and be ready to engage in the change process and to assign the necessary resources. I think this is not surprising knowledge, and we see a lot of this emerging from business and change management. Team members should also be supportive of the idea. For the living classroom, they need to be receptive to student participation in care planning and delivery within the home. The living classroom will have an impact on day-to-day practice, and team members must be willing to be mentors and role models to the students. Another indicator of success is having a history of successfully managing change within your organization. Organizational culture is a contributing factor as well. For example, does the culture within the long-term care home reflect a commitment to learning and innovation? And if students in the classroom are intended to learn about resident-centered care and how to work well in a positive interdisciplinary team environment, to see that modeled, then it makes sense that the long-term care home should demonstrate those qualities. Ideally, students would also be exposed to a range of care services and to residents with diverse needs. It just enriches the learning experience for them. And homes, perhaps homes in smaller communities, should be realistic about the potential to recruit enough students to the living classroom. So the size of the classroom that you're creating should reflect those realities. Physical space and other infrastructure needs must be considered. And of course, the quality of the partnership between a college and a long-term care home is foundational. Both organizations should be committed to working within a truly collaborative model based on shared values.
Okay, and that brings us to our next poll question, and that is where we're wanting to know what your answer is to the question. What do you think would be the biggest challenge to creating a living classroom in your long-term care home? So are you thinking it would be leadership support, human resources to support students in your home, organizational culture, physical infrastructure, or a partnership with a college? And if something that's coming to mind isn't one of the poll options here, just feel free to type in your response in the questions box on the right-hand side of your screen there. It looks like the poll options are still coming in. Give it a few more seconds. All right, looks like everyone has responded, and I'll just flip the results to share them all with you here. So as you're able to see on the screen, so most of you are thinking that human resources to support students may be your biggest challenge. Following that would be the physical space, as well as organizational culture and leadership support, or a collaboration with a college. I'm just looking in the chat or questions box here, and there was just somebody else who just wasn't sure. Flip it back over to the PowerPoint and hand it back over to Scott.
Great, thanks, Kate. So just a brief word about how to use the checklist. We hope it's fairly self-explanatory, but you can download the readiness checklist from the livingclassroom.ca website. We suggest that you work as a team, but you complete the checklist individually first, and then go through those 19 items and ask you to rank them on whether you consider this to be a strength or a challenge, or whether you need more information to make that determination. So it's not a numerical ranking and there's no score. Instead, at the end, we provide a few discussion questions. And the thinking is that you would use those questions to guide a group reflection around strengths and challenges, and to determine where more preparation may be needed. So this is where the full implementation guide can help. So as you set out on this sort of planning process, you can continue to use the readiness checklist at different points along that planning journey. If you do use the readiness checklist, and we hope you do, we'd be happy to hear your feedback. Was the checklist helpful? What kind of discussions did it prompt? And is there anything that you would add or change to the checklist?
Okay, and that brings us to an open-ended question. And so what we're wanting to know from everybody joining us this time is which other supports do you think that the Ontario CLRI should be providing to help long-term care homes create a living classroom? And for this one, there's no poll, so just type in your responses in the questions box on the right-hand side of the screen. And you might have to click on that little arrow next to where it says questions to put in your responses there to get that window pane to open. Yeah, so what additional supports would you suggest that the Ontario CLRI provide to help long-term care homes create a living classroom? And so some of the responses coming in include having some funding, receiving financial information, having a sample of a schedule of delivery. A couple other people just bringing up some funding. Yeah, so are there any other supports that come to mind? Another person is saying perhaps establishing a community of practice for newcomers being able to work with experienced long-term care homes. Another response is, maybe being able to assist with recruitment or providing staffing model egg samples. Yeah, and as well, another one that popped up here is maybe having a mentoring provision to the long-term care home, perhaps using that mentoring model. And that looks like all we have for now, but there will be another opportunity coming up soon to share any more questions or comments you have. I'll turn it back over to Scott.
Great, thanks, Kate. So those are great suggestions, and I encourage you, as you think more about this possibility, that you continue to send in your ideas. The good news is that a couple of the ideas are things that we are currently thinking about and in the process developing in the coming months and year. So those would include, for example, a few more project management resources. So mapping out what the process looks like and giving you a better sense of time required. The community of practice is also one that we are very interested in supporting, and in discussions with many of the program coordinators across the different sites, I think there's a shared interest in that idea, so look for more information about that in the coming year. We are also hoping to use that community of practice to start thinking about the evaluation process. We would really, I think ideally, come to some sort of shared understanding of what can we measure commonly across the various sites to help us understand the implementation process, what worked, what didn't work, and also what the impacts of building classrooms are. So those are a couple of pieces to look forward to in the year ahead. So if you want to learn more about living classrooms, I invite you to join us at the Advantage Ontario Pre-Convention on May 6th. So we'll be presenting as part of a full-day session on tackling the health human resources crisis. So I'll be co-presenting with Jennifer Plant, who is Director of Clinical Practice at the Pearlie and Rideau Veterans Health Centre in Ottawa. And Jennifer has also invited a PSW graduate of the program to share her experiences. So I think it will be a valuable exchange. I encourage you to join us. In closing, I want to acknowledge our partners, Conestoga College and Schlegel Villages, as well as the funding provided by the Government of Ontario through the Ontario CLRI program. Okay, I believe we have some time left for questions.
Yes, we do. So thanks very much, Scott. And so what we want to know now is if anybody has any final questions or comments that you want to ask Scott while we're here live with the webinar. And again, just type in any questions in the questions box on the right-hand side of your screen. And we have one question already. So someone would like to know, are there roles for volunteers in the living classroom model?
The short answer is yes. I think, as I said, it does, we see volunteering for the students, so they become volunteers within the home. But yes, volunteers can certainly play a role in the classroom. partly in the sense that if you have volunteers already involved in the home and activities, and that's where the students will be and learning, they get to see the volunteer role. One of the activities that can be added when you're developing the curriculum would be having students shadow particular roles within the home. So shadowing volunteers to understand their role within the home could be one option. Shadowing the general manager, the director of care, different ideas so that the students get a full perspective. There's no reason that volunteers can't also be invited to come and speak to the class about the volunteer perspective. So I think that we really hope that the living classroom involves everyone, and it really does. And that would include residents and family members as potential instructors, coming in, inviting them to come in, speak to the class about their various perspectives. And volunteers are certainly a key role.
Okay, thanks, Scott. And there was another comment. So one person was saying that they are in a rural home, so recruitment will be a huge challenge. And I know you were saying that some of the living classrooms that we are aware of are in northern or rural areas. So have you heard anything from them about how they're able to meet recruitment issues?
I have had some conversations with some of the smaller classrooms, and I think, first of all, recruitment is a challenge in any setting. We have to recognize that there are bigger issues around recruiting students into the profession, and again, something that the CLRI is very interested in pursuing. How do we begin to get the message out? So reflecting back on the first poll question about, what are some of those challenges, just perceptions of long-term care and so on. So we need to address recruitment, I think, from a variety of angles. The question about recruiting within a smaller community is a valid one. I think some of the smaller living classrooms have struggled to fill the class year over year. At the same time, recruitment, you really, because it's a smaller community, you have the opportunity to do more direct recruitment. You're not doing a shotgun approach across a wide. You really can do targeted recruitment, and there have been some interesting methods of recruitment that more personal and direct that have come up in those conversations. But you do need to be realistic in establishing a classroom about how much potential there is to fill the class year over year. So that would have an impact on the size of the class, for example. So in Waterloo and in Guelph, we have capacity for at least 48 students at any given time in the classroom. But in a smaller rural community, you may look at 5 or 10 students in a cohort. The implication there is in discussion with the college, how many students is sufficient to support the investment. So it may be that, and we have heard certainly some of the smaller communities have invested less in the physical infrastructure. So rather than laying out a lot of time and energy and building a fancy space, sort of using existing space, bringing the students in. So there are ways to do it more cost effectively.
All right, great, thanks. Another question we have here is how has the living classroom model worked in urban centers with colleges, and do private colleges impact on the model or concept?
The classrooms that have been developed are all, to my knowledge, done with support of public colleges. So the classrooms are, as you saw from the map, so there hasn't been a direct affiliation with a private college at this point.
Okay. All right. Another question for you here, Scott, is that somebody noted that you said there have been studies in the USA on the living classroom model, and this person wants to know if they are going to be referenced in the living classroom guide that people from Ontario long-term care homes are going to receive after completing our evaluation survey.
Yes, the answer is yes. There is there's a good long reference list in the guide that will point you to some of the key studies. That list is also posted on the website. Most of the text from the guide is also available through the site. And the ones to look for really are, there's a key literature review that was done actually in Australia, that scoping or review that looked at all of the, that sort of summarized all of the research and did the work to extract some of the success factors and so on. But I do encourage you to look at the full list. There's been a good set of research that was done across multiple sites.
Okay, great. And then another question here for you. This person would like to know, how might distance training play a role in helping PSWs get trained? It's wonderful for PSW candidates to be able to visit right there in the long-term care homes, but can some of the theory be covered electronically in between networks of learning PSWs?
Another good question. So you're correct in sort of understanding that, a large part of the benefit of living classroom is that face-to-face interaction and being on site in the home, because that's where the relationships develop and the exposure to the working environment takes place. However, and this applies again to smaller and rural and remote communities, it may not be feasible always to have students on site all the time. In fact, the models that we've seen in the Northwest include elements, sort of a blended learning approach. So some of the programs, some of the courses are delivered by distance learning. This really, I think, is more a reflection of access to instructors. So in a small community, you might not have a full complement of faculty available to deliver all of the courses. You do have access to the staff in the long-term care home, nursing staff who can play a role in instructing. But for example, one piece of training is the communications course that PSWs need to do. So your communication instructor might deliver that remotely. And I think it's a good model particularly for colleges who are serving multiple remote campuses, that they can centralize that. This speaks as well to class size. If you have a small class in a local community, why not blend several small communities together to bring class up to a size that supports paying faculty to deliver that program?
All right, that's a great idea. And a question for you from somebody else. This person's wondering, have high schools been involved from an apprenticeship program perspective, or is it just colleges with living classrooms?
To my knowledge, the living classrooms that we've seen have not included high school apprenticeships. However, thinking about engaging high schools, maybe the subject for a future webinar. We have been doing some work around intergenerational programming and engaging high schools to come into long-term care and exploring those opportunities. So I think it's a wonderful question and a wonderful thing to think about. Certainly, once you have the space and that structure in place to support learning within the home, that space becomes available to engaging high school students and others.
Definitely, yep. And the Ontario CLRI team, as Scott was saying, we will have more news to share about that soon, and we do plan on doing a webinar to cover that topic. And it looks like there aren't any more questions, but if there are any more, feel free to type them in now. Just wanted to take this moment to let you all know to feel free to get in touch with Scott using his contact information shown on the current slide, and you're also able to get in touch through the Living Classroom website shown at the bottom there. And as well, be sure to connect with the Ontario CLRI team anytime using these email, phone, website, or social media options. Check out our website that has lots of long-term care resources, and sign up for our e-newsletter if you haven't already, so you can be in the loop of when our next webinars and events are coming up. And as we were saying, that once this webinar closes in just a few minutes, that a pop-up survey will appear on your screen, so we ask if you could just please fill out those few brief questions, and that those of you from Ontario Long-Term Care Homes, that we will send you a free copy of the Living Classroom Implementation Guide. And so thanks again to Scott for sharing with us this really great Living Classroom information and overview. It doesn't look like there's any more questions that have popped up yet. And special thanks, as always, to Holly from the REA team for her wonderful webinar support. And we're going to be ending the webinar now. But as I was saying, please get in touch with us anytime with your questions or suggestions for topics that you want to learn more about. And I hope you have a great rest of the day.